Today we are going to talk about gambling disorders, understanding the struggle behind the behavior. My name is Graciela Murnik. This is for the course Issues in Impulse Control. Today is March 18th, 2026. I'm going to tell you the agency and my role. I work at Hope Recovery Center. It's a community mental health agency, and the target population is adolescents and adults. We are very interested in helping people with this disorder because it can harm relationships, financial, and also mental health. The agency provides behavioral support to addictions, and my role is to educate and give all the information about the gambling disorder, and also screen them and refer them to treatment, and in case they need referrals, send them to other agencies and do case management. What is gambling disorder? The DSM-5 says that it's a behavioral addiction, and it's an uncontrollable desire and an urge to gamble, with all the consequences that we have spoken before: emotional, financial, relationship, and the entire family suffers. Why does it happen? It happens because it is an impulse control. And an impulse control has the difficulty to resist the urges. And also because it's rewarding. So it works with the rewarding system in the brain's dopamine. And also happens because everything is at hand. Apps, casinos, online gambling, everything is very easy to access. Also happens because it's a coping tool to release emotional pain. And the other side is it can also be genetic, and because genetic is also a risk factor. We are going to see the emotional cycle, how it happens. We have the stress, the emotional pain builds up, so then the strong urge to gamble for relief, for release, and then the gamble brings like a short-term pressure. Then they have the guilt, the regret, the loss, and then the cycle starts all over again. More stress, gambling again. So the cycle, if we don't break it, is like kind of self-reinforcing. So it's very important to break it. The consequences is debt, loss of a job, the relationship, family problems, and they've seen also that there is in 40% they see they present a risk of suicide. So the diagnosis, we do the clinical interview, we check the gambling history and the life impact. Then the DSM-5 says we need to check 4 or more of 9 criteria in 1 year. Then we do like a screening questionnaire. Then we check also bipolar disorder because treatment differs. And also we need to check them for depression, anxiety, and substance abuse. co-occurring disorder. These conditions can worsen gambling, the ones that we've spoken before, behavior, and can make the treatment more complex. So it's depression, anxiety disorders, and substance use disorders, and bipolar. These are the co-occurring disorders that can come together with gambling disorder. So the best treatment is the CBT, cognitive behavioral treatment, because it works on the distorted cognitions, and also they learn the rational coping skills to replace. There's also medication and the SSRS that are the ones that brings more serotonin. There is the Gamblers Anonymous, the 12-step peer support, and also family therapy to rebuild the support and the trust. And in the treatment, we can also use case management for referrals to mental health, substance abuse, and other services as needed. Why early helps matter? Because with time, the pathology gets worse if we don't do intervention. We have to do the right support, and it has to be ongoing. We need to follow up. And human service professionals play an important role in identifying and helping the clients, identifying the risk, helping the clients do the right referrals, and as I said before, do the follow-up. Thank you so much.